my name's Carly Harity, and I'm working with Carlisle Dixon, and we're presenting on schizophrenia. This is part 1 of our presentation. So what is schizophrenia? Schizophrenia is a psychological disorder that's characterized by psychotic symptoms such as hallucinations and delusions. These significantly affect emotions, behaviors, and mental processes and mental content. These symptoms of schizophrenia can interfere with a person's abilities to comprehend and respond to the world in a quote-unquote normal way, as we would consider it. Some symptoms of schizophrenia, these are separated under 2 different categories, the positive symptoms and the negative symptoms. The positive symptoms are the psychotic symptoms such as delusions of control and hallucinations such as sensations that are not there, disorganized speech, disorganized behavior, which would be bizarre behavior or behavior with no purpose, as well as catatonic behavior such as movements and responses. Then it goes to the negative symptoms, which is removal of the normal processes. These are emotions and loss of interest. And then this group is sectioned under 3 subcategories as well, such as flat affect, which would be inappropriate responses, allogia, which is speech, and then avalation, which is the motivation. In this category of symptoms, there's also some cognitive symptoms that we can look at, which would be affecting memory, learning, as well as understanding. And these are, difficult to notice and see in patients that have schizophrenia, but they are still there. So positive symptoms would be hallucination and false perception, which includes auditory, which is about 70%, visual, which is 20%, which would be auditory hearing voices, visual seeing figures or shapes, and then olfactory and tactical is experiencing pain, and these are not as common as auditory and visual hallucinations. And I'd like to state that positive symptoms are not helpful and they're not positive in any mean. They are saying that there's new features that are happening within the person, aka like the psychosis that's occurring. So in the negative symptoms, this involves loss of normal behavior. Negative symptoms are associated with poor prognoses, and some negative symptoms are secondary to medication, such as the side effects that patients might be getting because of the medication they're receiving. And like I said before, there's 3 types of negative symptoms. And then these 3 types show the lack of normal mental processes within expression of feelings or behavior. So the diagnostic criteria for the DSM-5, the categoristic symptoms that a person must have 2 or more of the following to be present for a significant period of time during a 1-month period would be delusion, hallucinations, disorganized speech, disorganized or catatonic behavior and negative symptoms. And this is one of the criteria for a person to be diagnosed with this. They must have this for a significant period of 1 month. The second thing would be social and occupational dysfunction. This is for a significant portion of time. For the onset of the disturbance, the patient is functioning well below their usual level, and it would be 1 or more of the following areas, such as work, interpersonal relations, and self-care. And this is meaning that a person isn't able to do their tasks at work like they used to. They're not, communicating with individuals or having contact with people like they used to, and as well as self-care, that they are not able to care for themselves and they are struggling to meet their daily needs. And like stated, this would mean that it needs to be there for a significant period of time of at least 1 of these to be another reason to be able to be diagnosed. And the third thing is the duration, and this would be continuous signs of the disturbance must persist for at least 6 months. And within the 6-month period, it must include 1 month of steady symptoms to be able to have a diagnosis of schizophrenia. The causes. So the causes of schizophrenia is kind of unknown still, but some things that people will look into would be genetics, abnormal brain structure, dopamine hypothesis, as well as glutamine hypothesis. And then on the next slide, we'll go into those a little bit. So genetics would be, it looks in there are some family studies that have been done, and families that have schizophrenia in other members have a higher risk of having schizophrenia in family members along the line. And then they also looked at adoption studies, and the risk of schizophrenia is still really high in adoptive children with their biological parents having schizophrenia. So even though they weren't raised with the parent who has schizophrenia, their chances are still high. Then the next would be brain abnormality, and these are identified by doing different tests such as CTs or cerebral blood flow studies. Some patients have one or more of the following below to be kind of another sign of maybe why they might be experiencing schizophrenia, and that would be reduction of blood flow to the left globus pallidus, problems within the patient's frontal lobe, medial temporal lobe is thinner than it should be. The interior hypothalamus is smaller than it would be normally, and then the lateral and third ventricles are enlarged. And like stated above, they have one or more of these. So they might not have all of these, but these are just some things that have been found. So the prevalence of schizophrenia, I first want to just talk about real quick before we get to that, the different phases that individuals go through with schizophrenia, and there's 3 phases that have been identified. There's the prodromal phase, which is withdrawn, and then it goes to the active phase, which has the severe symptoms such as the delusions, disorganized speech and behavior, catatonic behavior, as well as hallucinations. And then it goes to the residual, which would be the cognitive symptoms. And it goes in that order normally, but it can also go back to the prodromal phase, so being withdrawn again. So it's not a one-time cycle, and it can be a continuous cycle where they go through these stages, but it could be at different times, and it might not be, a continuous flow through them all. The one person might be in a stage for a while. So back to the prevalence. So schizophrenia is one of the top causes of disability of adults that are in developed countries throughout the world. Also, about 1% of all adults will develop schizophrenia. In the United States, about 5% of people with schizophrenia are homeless, as well as 5% are in hospitals, such as inpatient psychiatric unit or long-term psychiatric hospitals, and then 6% are in jails or prison. And then together, these 3 groups of people represent about 16% of Americans with schizophrenia. But in contrast, there are 34% of people with schizophrenia who are living independently and are not necessarily in hospitals, homeless, or jails and prisons. At times they might be in hospitals, but for the most part, 34% of individuals are living independently. So treatments of schizophrenia are quite difficult. There isn't, a treatment to get rid of schizophrenia. It's more of to control the symptoms. So some things that can be used are antipsychotics, which have been found really effective for most patients, but unfortunately, there's some additional things to consider, such as the cost of these are really expensive, and if you don't have insurance, that can cause issues for patients, as well as their side effects that could add on to the symptoms and the issues that these patients are facing by the medications that they're taking to help schizophrenia. Also, within the treatment, it's important to have help from several different disciplines, such as therapy, medicine, and psychopharmacological, so everyone can be on the same page and working together. So the video that I chose, I felt like did a really great job explaining schizophrenia, and it gives a brief overview that's pretty clear of what schizophrenia is and the different things that individuals with schizophrenia might face. So these are the references that I used, and thank you so much.